I really did stay to support you guys, so I don't know that I have a question except for thank you all for dedicating your time today to present to all of us with all of your knowledge. I'm super grateful. I don't really have a question though. Sorry.
Thank you. So you've mentioned the loss team a couple times throughout the day today. Our loss team does the in-person responses. So for doing the suicide review board, would those reports that we do, because when we do it, obviously our responders then write a report, which includes a lot of scene information, a lot of those anecdotal things. We've had people say, look, you know, he was worried he was going to get, you know, charged with this and this. So would that be information that would be brought into the panels then at that point too, or into the reports besides just the resources to the families and everything else that we do on the back end, but on that scene information that we gather because we are there at the time also?
Yeah. So our loss team, like I said, we go ahead and dispatch them through our coroner's office, so they're going to be on scene with us as well. And I've seen it many times. They're going to be much rather to talk to someone who's coming from a loss team compared to, you know, an investigator that's, you know, dressed up in their investigator attire. They might be more apt to speak with that lost survivor who's on scene to have that peer approach. So we actually have Angela, who's the executive director of the loss here in Franklin County. She's on our review. And so we would just leave that up to her. If she had that information and she would like to share that information, yeah, I mean, that would be extremely important information. And again, they might have information from their connection with that survivor through the you know, groups that come later where they discuss that a little bit more that we wouldn't necessarily have in that psychosocial because it wasn't mentioned in prior to that. So yeah, I would be open for that information to be shared as, again, that's going to inform the recommendations. That's just more information related to that decedent. So again, I think it's important to have loss teams on your fatality review from not just that lived experience, but also that right there is that family member is going to probably be more apt to speak with them than anyone else. And so they're going to have really, really key and important information that would be collected as time progresses, as they've navigated their grief process. They might hit that very actionable part of their grief or they want to do something about this. And so they'll say that information, and then Angela would be able to provide that for our review. So yes, that would be wonderful to have.
I don't know who the best person is to answer this. It might be you, Tiffany. But I'm just curious what ongoing support looks like specifically for those that are leading SFRs, like our health department, just because it seems like there's a lot of variation in how they're run. I didn't know if there was any opportunities for ongoing support outside of this conference.
Yes, there will be. Well, regarding the conference, everything, you know, most sessions were recorded today as well. So that'll be uploaded, you know, on the OSPF site, also be shared on the ODH website moving forward. You know, the manual and all the downloadable PDFs, that'll be made available. Outside of that, yes, absolutely, from the Ohio Suicide Prevention Foundation, you know, we will be working with ODH and other state partners as well to continue to support the work. During the session that Dallas and I co-presented before we did the mock demonstration, I was talking about, you know, kind of the retrospective fatality analysis training and what that can look like. The goal there being is we want to do something similar to what we did today, but specifically for those who kind of work in the psych autopsy world, to learn from those who've actually conducted them in Ohio. So to continue to offer those types of learning opportunities and learning communities of practice, absolutely. This is just the beginning, right? You know, I noticed that, you know, there were some great questions throughout today, but I feel like I was anticipating more questions, but I think, you know, as I was chatting with you know, one of my coworkers up here, I think that this is so new that some folks just didn't know what to ask, right? Just because this is so new. So what I'm saying is, yes, there's definitely more to come because this is a very new area in the state of Ohio. And, we're going to continue to learn from, what other states are doing as well, and hopefully adapting and, Ohioizing, as we like to say, to bring it here. So yes, there's more to come. I just don't have many more specifics at this moment. We're continuing to develop that out, and I'm open to hearing from anybody, honestly, of what that could look like, just because you all are doing the actual work in your community.
I appreciate that, and I'll just add, like, seeing the actual panel was very helpful. In Stark County, we've been operating our SFR for about 2 years now, and I can tell you that is not how it's run. And so that's why I was asking about what could support look like for the health department specifically on how they run that, because they don't share the decedent information prior to, and so that we're all bringing that information from our retrospective systems, and I can just see the added value, because oftentimes we are saying, well, it'd be nice if we had this information, it'd be nice if we had this information. So just if that could be something that health departments, I think, are helped with, that this is best practice, I think that would be helpful.
Ellen, I'll just echo your need for equity in all this space, whether it's the data, whether it's who's at the table, whether it's understanding the importance of this work. We all need to be on the same page, and I know it was a mock demonstration, but I think it really showed what kind of information can come out, what kind of recommendations when we have good data and we're on a good working level together. So even just my community and yours next door to each other, very different in how they're functioning. So thank you for bringing that up.
I'm from Wyandotte County, and we are very small, and we do our CFR, OFR, SFR all at one time. So I think last year we might have had 6 cases to review when we had our meeting. When we sent out the invitation to everybody, we sent the name of the decedent and the date of death so that they could bring whatever reports they needed to review. But I also asked for, like, the coroner's reports, the EMS run sheets, and anything that the police department had ahead of time, because I try to fill out as much of the form as I can before we go, especially for the CFR, because it's like a 26-page form. And then that way, when we get to the review board, I basically go down through the questions that I don't have answers to, and we discuss along that lines. And then at the end, I ask for, like, narratives. Is there anybody who wants to add anything? Is there anything we can change or do differently? And then I document all of that. And we have a lot of stakeholders at our meeting, so then they can all take away the ideas of what we need to do with our recommendations. And at the health department, then we try to implement, like, the naloxone or the test strips or whatever we are going to implement through us. The other question I had, besides giving you some information, was if anybody has a family, like, interview form that they'd be willing to share with me, or any questions like that, because, like I said, we don't have that many cases. And we have never reached out to the family because they didn't think that it was necessary. But there are some questions that we don't have answers to that I would like to, at least to try to make contact with the family to see if there's anybody that would be willing to respond to them.
Yeah, there's an example on 61 of this. Yeah. Next of kin interview form.
It might be a question for Dallas, and I may not ask the question right, and it might just be me not understanding the process. We've talked about this before. You and I have talked about this before. If somebody does the injury in another county, and then they get transferred to Franklin County, you guys do the autopsy. How does that small rural county get that information? Do they review the case?
Yeah, that is a good question. And it is a process that I've attempted to navigate, and I haven't really gotten much feedback from it, and I'm still trying to navigate that. Because in that situation, yes, we would be the jurisdiction that's involved in that death, and therefore it would be on my case list, and I would review that if that case is just one that's selected with available information and through all my case selection process. But that would go into my data set, but I do identify it differently than the rest. And so I'll actually place that on the list and turn it a different color. I know you don't know what the colors mean, but essentially as an out-of-county injury. And so I still find it important to report on that death, because if not, that the jurisdiction in which that injury took place would not have that death on their database. They wouldn't necessarily know that it even happened. They would have, it could possibly be in their attempt data collection or anything like that, but they would not review that death or even sometimes know that it happened unless it gets reported back to them, and that's the issue.
But it wouldn't go, it wouldn't, like for the Department of Health, we would see it as a Franklin County death.
Correct.
So means we've got a lot of underreported rural counties.
Correct. And then we have a lot of them in Franklin County because we have a lot of trauma
Right.
level 1 hospitals, and so a lot of them from all over the place are being transported to our hospitals and then passing away, and then that death is reported to us, and then we're collecting that information. So again, even if I didn't even identify that as an out-of-county injury and put it on my database, no one would know that. That death would not be reported in any database, which is an issue.
Well,
Go ahead.
I would imagine they could review resident cases and go through vital records to get their case list. Would that be okay under ORC?
I'm not sure if that's how it can be pulled. So I'm not sure. I just know it seems like we're missing something.
Correct. But I think our office would be open to sharing that information if the rural county did want to review that death. And they wanted information related to that, they could probably reach out to us and obtain that information through our coroner's office. Now, we wouldn't have a scene response because it happened at a hospital, so our information would be limited as well. But we would have everything that the hospital gave us throughout that report. That would be included in our synopsis. It would be in our report. We would send out the subpoenas for the records and everything. We couldn't share those, so we would just have limited information. But we would be willing to share what we did have to that rural community if they wanted to review that death as well. But I just have not seen that happen, and I was just always been fearful that that data point and that person was never talked about, and so I made sure that I included them into my data sets, and I just identified them as a little bit different as their injury occurred somewhere else. But I wanted to make sure that the amount of our suicides did include those deaths in which occurred at our local hospitals. And so that's something that we definitely need to approach and figure out the best practice for that.
Well, and knowing how data is shared in some of the rural counties, my guess is they probably wouldn't even know to request it. They probably don't even know that the death has occurred. But I can even think of cases where we've had in Summit County, we've had a similar situation. Someone attempts in one county, ends up in Summit and dies. And it's almost like which county, takes responsibility, which county even knows that this was their individual. Sometimes it's, with youth, it's the residents in both counties, and that makes it tricky because, with divorced parents and things like that. So we've definitely had cases where I know there have been deaths that took place in Summit County that their home county was not even aware that person died unless there's school outreach or something like that.
The coroner's office in those circumstances should be sending a subpoena to the local law enforcement agency that would have went to the scene of that attempt before they were transported to the hospital. And so a lot of times we could inform them that way. We'd be reaching out to collect that information and saying, hey, this person died. We need the information related to your scene investigation to ensure that you didn't have any belief that it was anything other than a suicide, or what was your findings from the scene. So yeah, it would come down to information sharing, and I just unfortunately don't have the best answer for you in that, outside of it, someone being in the coroner's office, seeing that was an out-of-county injury, and then doing the work to then report that to that county that they came from. And I don't see that happening a lot, unfortunately. So that would be a conversation that we would continue to have.
And I can add from a rural perspective, so we're on the opposite end of things, right? But we have data sharing with our mental health board. They're getting information from our local first responders. And so if they see something come across that is a suicide attempt or an overdose, that we know was transferred then out of county to for us, it's a lot of times a Toledo hospital or a Cleveland hospital. The MHOS board is communicating to us that they saw that in their records, and that's not one that we would have. And so that's when we start looking into it. If we know where they're transferred, like you're saying, we can get a hold of that county. We've run into some issues where it's not clean or easy to get a death certificate from another county. It just kind of depends. Some counties are willing to share with us, and some counties are not willing to share with us. It's my understanding that with the changes coming to death certificates at the beginning of the year, that might be helpful for us because we'll have access statewide to death certificates instead of just being able to see the deaths occurring in our county. So we're hoping that part will be helpful. But like Dallas is saying, it's just we kind of hear about a situation and then we can dig into it, and we do review when we know it's our resident. But if we don't hear about it or it's not coming through law enforcement, like if the injury happened also out of county, we're not going to know about it.
Yeah, and I will say something that a lot of people don't necessarily know is that the coroner's report, when it's finalized, it's actually public record. So you actually could just request it through our website and you would be able to obtain it that way. But again, it's about knowing where that death occurred. And if you didn't know, then you would know where to reach in that public record request. But that could be a way, if that county did want to review it, they could send a public record request into our office, obtain our coroner's report as well as autopsy and toxicology, and then utilize that for the review as well.
It even gets more challenging when a person dies in your county and they're from out of state. And we reviewed a man, and he lived in Arizona. There was no next of kin. Literally, all we had to this person was his demographics and where he died. So it did feel like a disservice to him. But there are definitely challenges when they're non-residents.
Other states will have laws that even refuse a subpoena. They won't even provide that information. I've had that situation because we have students who die at our local universities, and then a lot of times they come in from out of state. So all of their involvement is from that different state. And I have reached out with a subpoena, and they sent a lawyer back to me saying that we don't have to comply with your subpoena because of that state law. So that's another gap, unfortunately, and it is a disservice. Now, luckily, sometimes that individual would have service at our university, and so we can get something. But just that more in-depth information we're being halted because they're saying that they don't have to comply with our subpoena, let alone an information request or any other way that we could reach out for that information. So you're right. It's a big hurdle as well for those individuals.
I was going to say, Tiffany, are we supposed to review any? We have only reviewed resident deaths. So if they are from our county and they die of an overdose, suicide, or child, those are the ones we review. So if they're from a different county and they come here, I usually send a redacted copy to the local health department. So if it's a Hancock County resident, I would send it to the Hancock County Vital Statistics for their review board. And maybe that's where you're missing data.
I think you're supposed to be reviewing your residents. I think I'm looking at it more from a state perspective. It feels like the map that we put out is missing some data. You know what I mean?
Oh, yeah.
If the suicide is getting reported in Franklin County, instead of Jacksonville, when it comes to writing grants, getting funding, Jackson maybe has a higher need, but their numbers are not showing.
Yeah, and I would argue there's even other reasons that it's underreported as well. It's not even necessarily that the death occurred somewhere else. Certification of death is a medical opinion, and so a lot of things can go into play when it comes to politics and things like that. So even in those rural communities, the suicide fatalities might be extremely underreported for other reasons outside of that. But you're right, the legislation that's in place, you're only supposed to review those cases in which, so I've never reviewed an out-of-county case. I would if I could, but that's why I at least make sure that that death is computed on my data set so that when I'm reporting out to stakeholders, I can say, well, we have 170 in-county suicides, but we actually have 185 because of all of these out-of-counties. And so they at least are being identified as a suicide death so that we can improve our data sets. But unfortunately, underreporting of suicide specifically due to stigma and other reasons is a big, big statewide and probably even nationwide issue. So.
I was also going to say, if you have a relationship with your vital statistics registrar and she has access to the Ohio data warehouse, she can run a report for the county to see how many deaths were reported for county residents as suicides, overdose, child fatality. There's many reports you can run in there to figure out what your number should be if you have questions.
There's actually one behind you. I was trying to say you're third. Sorry. Drive by.
Sorry. I was just going to say along the same topic and to echo over there what Wyandotte County was saying, because Wyandotte County is one of the counties in which our board does cover. So we did have an issue in the past where grant funds sometimes are tied to the number of deaths that you have in your county. So we did try to get some clarification. So as a board, we have kind of had our conversation with all of the health departments in each of our counties to say that what we really want to do is to measure who a county of residence, because as a board, if they left the county but only by like a couple of miles because the hospital was in the next county, we still would have been servicing them as a board with our local services. So wanting to make sure that we count those numbers, even if they were in Fostoria and they died at the hospital in Fostoria, which is in Hancock County, we still want to make sure that we're able to say, but truly they were a resident of Seneca County, and we want to make sure that we're able to count them because we would have been serving them. So it's so hard, and like everybody said, if you hadn't heard about it, then you don't know. But as Nicole said earlier, we also have the mobile crisis response team that's responding to first responder things. So we're usually able to be aware, especially since we cover 4 counties. Sometimes it happened in Sandusky County, but it's an Ottawa County resident. So usually we're able to catch that, but it's so hard to differentiate, especially like we don't have a trauma hospital either, like you were saying. So that happens really often.